Hello, and welcome to Women's Health. My name is Kathie Uhrmacher. I am the current chair of the Mayor's Commission on Women, and I also serve as the president of the Women's Foundation. Last year, the Commission and the Foundation led a survey of 1,250 women in Lincoln and Lancaster County. We asked them what their current challenges are. And among some of our answers, like health care concerns and, of course, the economy, one of the things that we were surprised about is that 28% of the women who responded to our survey said that domestic violence was one of their top concerns. Because of that, the Women's Commission, in conjunction with the Women's Foundation, launched into a domestic violence awareness campaign, and our partner in that is Voices of Hope. Today, my guests are Marcee Metzger, who is the Executive Director of Voices of Hope. Welcome.
Thank you, Kathie.
And Marla Sohl, who is an advocate for Voices of Hope and works very closely in this area. Today, we're going to be talking about the health consequences for domestic violence. Some people that are watching our program know that we had also a television program that we put up with Sue Anderson from Voices of Hope. And we talked then really about more definitions. What is domestic violence and what kinds of things do people experience? What kind of resources are there, etc. But we really wanted, because this is women's health, we really wanted to talk more specifically about the health consequences, both short-term and long-term, for women and those who are victims of domestic violence. So let's first of all talk about why we would consider domestic violence and sexual assault a women's health issue.
Well, Kathie, Voices of Hope has been in Lincoln for 40 years and has been hearing about the consequences of health in intimate partner violence, family violence, spouse abuse, however you want to talk about domestic violence. We know from both national surveys and in Lincoln that 1 out of 3 women in their lifetime experience domestic violence. And the Centers for Disease Control and Prevention has identified it as a major health concern for women. So when we talk about 1 in 5 women being raped or 1 in 6 women being stalked, when we talk about in Lincoln, I mean, lots of people say, oh, that's happening all over, but not here in Lincoln. But the same statistics bear themselves out here too. About 1 in 4, 1 in 3 women talk about in surveys. The Gallup did a survey for us, and actually they've repeated it several times and found that about 28% of women indicated that they had personally experienced domestic violence. Your survey bears that out, how much of a health challenge it is for individuals. So when we're talking about domestic violence in Lincoln, Nebraska, our agency last year saw 1,618 unduplicated adult victims. About 200 of those were men, and the rest of them were women. And we saw about 470 some children, and those children are also impacted on this as a health issue.
Sure, exactly. And I think that it's important to mention again, as we did on the previous program, that when we're talking about domestic violence, we're not just talking about the battering and the physical violence. We're also talking about emotional, verbal, financial, I think we mentioned on that program as well. So when we're talking about the health consequences, we're talking about physical consequences, but we're also talking about emotional consequences, mental consequences, those kinds of things. And those often turn into then physical types of things as well. Right. Let's start talking about the immediate impact of sexual assault and domestic violence on a woman's health. What are some of the immediate health consequences to abuse?
Well, in relationship to sexual assault, you have the immediate injuries, whether that's internal or external, but there's also risk for STDs. There are risk for pregnancy. A number of risks that a lot of people don't think about. You think about the emotional effect that a sexual assault has on the victim, but not necessarily on wow, could they have a long-term issue such as an STD that they've contracted from this one-time
And
experience.
STD, by STD you mean?
Sexually transmitted disease.
Right, okay.
And it's been estimated that up to 1 in 15 sexual assault victims can contract an STD from the perpetrator from the sexual assault. There's also the immediate crisis that they experience that oftentimes will turn into a longer-term health issues like post-traumatic stress disorder and things of that nature.
Right.
So there are a lot of, when I talk about sexual assault, I talk about it in terms of kind of a ripple effect, that when you throw a pebble in a pond, you've got your immediate big waves, but the waves go all the way out to the end of the pond. And you wouldn't think sometimes that it would affect things years later, but when we're talking about people's health, domestic violence victims oftentimes have undiagnosed traumatic brain injuries. They just have no idea that they have them. But that affects their memory, it affects their ability to carry forth tasks on a daily basis. And so the health ramifications are extreme.
Right.
And Kathie, when we look at the Surgeon General's report on this, that from the ages of 16 to 44, it's the largest cause of injury to women. So we're talking about injury prevention, and we're talking about it's more of an accidents, muggings, and rapes combined. So it's really a major, the physical injuries can be very traumatic, but then there's also the living in fear all of the time, living in isolation, all of the different tactics that somebody who is living in a household where there's violence going on may be experiencing, immediate migraines and all kinds of other chronic illnesses that are immediate to them. Safety is really of concern, and so when people are making referrals, when family members are concerned, it's really important that they know about referrals and know that they don't need to be isolated, and that in itself, talking about these issues, can improve on an individual's physical and mental well-being.
And I think that we forget that particularly sexual violence, sexual assault, is not necessarily a stranger. Or even in a dating situation. We may be talking here about sexual violence within a marriage, within a partnership, right?
And I think it's very safe to say that if there is threat of or there is physical violence within a relationship, that the ability for someone to actually consent to sexual activity has been minimized because of the fear of what will happen if they don't. And it is very common that sexual violence is part of the control tactic that is being used against the victim. However, it is not spoken about. It's very shameful. The effect of domestic violence in and of itself is shameful, and then the extra shame of a sexual assault within that context is very hard for people to talk about. So, and you're right. The majority of sexual assaults just on the in the public is not due to a stranger. It's mostly about 85% are committed by somebody that the victim knows.
So either in a dating relationship or in a marriage.
A dating relationship, in a marriage, or some sort of acquaintance. Yeah.
Right, exactly. And then I think that, again, when we're talking about the immediate consequences, if a woman does go to seek emergency care, then often it appears to be more the bruises and whatever injuries, and then maybe not the sexual part of it gets brought into it, and so that's another concern.
Well, across the country, best practices are to do screenings about this, and one of those really has to do with, are you feeling safe in your home? And if you can't answer that, it's not that the wiring is bad or that there are other kinds of physical household things that are problems. But if you're afraid of the people that you're living with, then that's a major indicator that there's domestic violence going on. So best practices with trauma centers like our emergency rooms, physicians that do OBGYN care, orthopedic physicians because of the amount of injuries to various limbs from being restrained. All of those places now are being taught to screen for domestic violence because it's such a major cause of health concerns for women in our country.
And so in the intake questions, they're asking questions about safety
and what is happening in their home.
And what's happening in their home.
Getting to whether you're being hit or slapped or shoved or restrained. All of those kinds of things would be something that they might ask as a follow-up. But we're starting with, do you feel safe? And so
Because they might be more willing to answer that question
Exactly.
than go straight for, here's the reason that I'm here,
That's right.
because of the fear.
And the incident that day, they might have come in with chest pains, and we know that individuals that experience this are more likely to experience domestic violence. According to the CDC, I think it's 70% more likely to have a stroke.
Is that right?
Which is incredibly high when we're talking about the amount of impact, long-term impact on individuals who are living with
Right,
us.
exactly. And then also, obviously the research shows that long-term stress in a situation will cause physical consequences, and those have been well documented for anyone who's under an incredible amount of stress day in and day out. And I think we tend to think of that at the workplace or something else, but seriously, if someone was in a home where there's constantly the threat of violence, then obviously that stress will spill over into long-term health consequences in the sense of illnesses that you might not have even associated with it.
Well, and I think also the emotional impact and toll that it takes on victims. And so it's very likely that victims of domestic violence and sexual assault will walk away with those incidents from of violence with post-traumatic stress disorder, which increases their hypervigilance and their startle response, which if you think about how you feel when you're nervous, and that's a constant feeling, can really take its toll. I think sexual assault victims are 3 times more likely to experience depression, 26 times more likely to abuse alcohol and drugs. So the long-term effects are really far-reaching. I feel like that people don't get a view of what it is past this. Once they're out of the situation, it's like, oh, they're safe now, we don't need to worry about it. But the trauma that they experience really affects so much of their lives. There's a high correlation between a sexual assault and eating disorders, sexual assault and self-harming behaviors, sexual assault and irritable bowel syndrome, sexual assault and fibromyalgia. All of these things, a lot of that is sexual trauma as a child, but a lot of them have a very strong correlative relationship. And I don't think that just publicly people are aware of that. And I'm not sure that in the health system people are really that aware.
We see more and more doctors that are going through training and because they've identified this, the Surgeon General, the CDC, I mean, a number of medical best practices. I think there's a lot more training that physicians are starting to have, but this has been a very isolated issue. I mean, I think for a long time people felt like this was a very private issue. It only happened in the home. People shouldn't become involved. And then I think there was a lot of focus on, look, this is a crime, when talking about domestic violence or intimate partner violence or sexual assault. And so trying to raise awareness that this is a crime. And in Lincoln, the police chief will talk about that this is the largest cause of violence in Lincoln is this intimate partner violence. The most incidents that they go to investigate tie into intimate partner violence. And so it's pervasive in our community. But I think about 10, 12 years ago when they started talking about this more as a public health issue, that it wasn't just a women's issue, that it wasn't just a criminal justice issue, it was an issue for all of us as a community to look at and to take into consideration what are the community, not best practices, but the best wellness of a community. That has to take into consideration this particular health problem.
Well, so let's talk a little bit about what kind of consequences there are to the collectivity then. Because obviously we're talking about immediate consequences for the victim. We're talking about long-term consequences for the victim. But it's important, I think, for the community to realize that if this is a public health issue, it isn't an isolated thing. It is a community issue. But there are consequences to the collectivity, right? So what are some of those?
Well, there are statistics that talk about the cost to the employer in the United States of domestic violence victims, and they say up to $13 billion each year due to domestic violence.
And in what ways are we talking within the workplace?
Productivity, days of missing due to illness, injury, just can't make it in, or court issues, a number of different reasons why.
But also those direct costs. How many times somebody needs to seek medical care? How many times they have to go back for chronic illness? What happens in terms of mental health services and care? So all of those have a cost, both in terms of financial, direct financial, but also in terms of time and productivity.
That's very interesting. I don't think a lot of people would even think about the employer and the consequences to the place of business, you know?
Well, and with domestic violence victims, a lot of times they are limited to the amount of time they can spend outside of the home, whether or not they can have access to their own finances, if they can have a job. And so if a victim is able to leave and flee a situation, there's a period of time where they have a very difficult time finding work and finding a way to sustain themselves and their families. And so in those situations, we do see some public assistance going towards those victims. And so that is again, a cost to the collective.
Yeah. And then we think about the co-occurrence of what's happening with child abuse and domestic violence. What happens when kids are witnessing this? How does that play itself out in terms of those children's behaviors of increases truancy and all kinds of other kinds of medical issues, as well as the direct physical or sexual violence? Those are high costs to our community. Recently, we've continued to do prevention activities, but I suppose maybe 10 years ago we did a survey with all the teachers in Lincoln Public Schools and asked about whether bullying and dating violence and domestic violence was having a direct impact on the kids learning in the classroom. And I think they had one of the highest return rates of their teachers ever in terms of talking about how it did impact on their classroom, on kids being able to be attentive, to be able to feel, not in that hyper-vigilant, startle response, unable to feel like they can be in school, missing school because of what they were experiencing in their homes. And all of this comes together for us as a community to say this isn't acceptable.
Right.
But if it's happening to somebody, they shouldn't be blamed for it. We need to make sure that victims and their children, whether they're women or men, be safe. And we need to hold accountable the perpetrators. I think that's one of our mottos, is that we always come back to what do we do to reduce the vulnerability of women so they're not having these health problems. But we also want to make sure that we're stopping it, and the only way we're going to stop it is to stop perpetrators from behaving that way. So engaging the community to say this is a problem that we're going to speak out about, which is why we've been so appreciative of the Women's Foundation, helping people to understand as bystanders even that it makes a big difference on the health and well-being of our community.
And that it's everyone's business.
And it's everyone's business.
And really, according to what you said then, Gallup is saying that even if you yourself are not victims of domestic violence, many people in this community know someone who is, have seen it, have heard it, know about it. And so therein again is the silence is the problem. And that we need to all speak up and say, this isn't what we want. This isn't what we want for these people, but it's not also what we want for our community.
Well, that same survey indicated 53% of those that were answering, so these are adults in random households, 53% said that they had personally witnessed a domestic violence incident. And so when you're talking about that, that's not in another community, that's Lincoln, Nebraska.
Right, exactly.
So then what do you do? I mean, when you witness when you're experiencing yourself or when you're witnessing it, it's really important for people to know, to not be victim blaming, to know what resources are available, to not be isolated in their homes, to speak out when they hear things that are biased in terms of gender even. I think all of those things create a culture that makes domestic violence acceptable.
And I think, so often it's easy to say, well, the media is to blame for some of these attitudes and behaviors, particularly, I think sometimes young men towards young women, some of the vocabulary, some of the things that are done. But as long as we tolerate that, then we are to blame as well. And so even though the media and some of the things that are happening in advertising and stuff like that are what we would maybe say are not appropriate, it's still our responsibility to do something about it. Let's talk a little bit about children. This is a program about women's health, but obviously women's health, it really impacts as well their children. So what are we seeing physically and emotionally with children? Much of the same thing that we see with women?
Well, I think that they definitely have, for children that have to witness this kind of thing, there are a lot of emotional issues that go along with that. Sometimes children get recruited into the abuse and into the violence. A lot of times you choose the parent that is most dominant because that's the safer parent for that child. And sometimes they're recruited in the violence against the mother. In other ways, sometimes they're trying to protect the mother, and so try to intervene and get injured in the process. And so children in these situations absolutely are affected, whether or not they ever see a hit, whether or not they ever visually watch their parents fight. If I hear my parents arguing from the basement, I know that something's not right.
Right.
And so they absolutely have emotional issues that come from it. And but what it looks like is very different than what it looks like for an adult. And so you might see that a child is acting out and seeking some really bad attention, or that they are not paying attention in class. They can't effectively do their homework. They're falling asleep at school. And all of those things just look like a troublemaker. Instead of, what's going on with this kid? Why are you so tired during school? Or why do you need my attention so badly, even if it's in a negative way? And so I think if you give consideration to, it's maybe not just regular kid being a naughty little kid, but trying to figure out what's going on for them.
Sure.
So and little kids have their own display of emotions, and then teenagers have another, and a lot of times it's chalked up to the developmental process instead of to what's really going on.
Right. That's a really good point to make. Now, we also do have in place in our public schools information about dating violence and relationship violence, right? And so that's an important thing for us to mention, that the Lindsay-Burke Act created that situation so that Nebraska then passed a law that all of the public schools need to have that kind of information. So, we can hope that that kind of information is getting to all of the students in our public schools. All right, let's talk then. Let's talk a little bit about Voices of Hope. I'd like to have you tell us what Voices of Hope does for the people that we're talking about here, what your services are. We've mentioned that on another program, but I still think it's important for us to mention it. And then perhaps other agencies that are involved in these kinds of things in our community.
Well, Voices of Hope, as I think I said earlier, has been in existence as the Rape Spouse Abuse Crisis Center for a number of years, and 40 years being in our community. At the core of our services are our 24-hour crisis line, 24-hour response to the emergency rooms or to law enforcement, which could be the sheriff, the police department, state patrol, the university police department. We do a lot of walk-in services. So somebody who's experiencing this and their physician tells them that it's impacting on their health may be told that they can just walk in at Voices of Hope, and during the day between 9 and 4 on most days and 9 to 7 on Wednesdays. They don't have to have an appointment. They can come in. Our staff will do safety planning. We'll talk about the impact on their children. We'll talk about resources in the community. They may have not wanted to talk to police before that day, and police will come. And our facility really is kind of big old houses that have been hooked together, and it feels like it's, in your grandma's house, that somebody's going to serve you cookies, But it's scary things that we're talking about. But we do it in a way that's very empowering. Everything that we do is confidential. It's very important to us to help people understand that confidentiality really does equate to safety, both physical safety from the abuser, who may be controlling every movement that they make, but also the emotional. When you choose to come forward, when you're ready to talk about some of these things, then that's the point that these can be more easily addressed. We do a lot of support groups. We do psychoeducational groups. We have a project where we have referrals from CPS, so individuals who are the protective parent. They're in a household where violence is going on, And they're being told that they could lose their children because we can't stop the batter from behaving the way he is. And so all of these protective things that they might be doing to keep their kids safer, to make sure that they get to school, to help them to be able to process what's going on. We teach a class that's DV 101 in parenting that looks at the co-occurrence between child abuse and domestic violence. We do a lot of other groups. We have couple support groups for domestic violence. We have one that's in Spanish that we do at El Centro de las Americas. They have a strong DV program that they've worked with us on probably 6 years now.
That's great.
We have a group that's specific for African American women. We do a lot of prevention and training activities in the schools. And we have projects in the schools. We have advocates at UNL and Southeast Community College, and pretty soon at Wesleyan.
Fantastic.
So we really do believe that nobody should go through this alone, and nobody can fix this alone. It's a very complex problem. And so our agency is open for every partnership that we can find.
That's wonderful. Well, we want to thank you so much. Again, Marcee and Marla, thank you so much for being here today. This is a really important subject for all of us, and we really appreciate all the information that you've given us today. For more information about Voices of Hope, their 24-hour crisis line, and other agencies in Lincoln that you can get services for, you'll see those in the credits after the program. Again, we want to thank the Women's Commission and especially the Women's Foundation, who through a grant from Lincoln Benefit Life were able to bring this program to you. If you have further questions about domestic violence, please visit our website or the website of Voices of Hope. This has been Women's Health, the Consequences of Domestic Violence.